On this week's special, I am doing a show on life with lupus, and my special guest is Miss Gertrude Minaj. She is the grandmother of the famous rapper Nicki Minaj. She's 60 years old and she's been living with lupus for 17 years now. So let's welcome my special guest. Woo! Hi, Miss Gertrude Minaj.
Hi.
Who do you have with you today?
This is my husband Garfield.
Hello,
it's
Mr.
nice to
Garfield.
meet you.
Thank you for having us on your show.
Of course. So I remember you told me that you brought me some nice pictures to show the audience.
Oh yeah, of course. As you know, I brought Garfield on the show with me today for moral support. And this is actually a picture of Garfield and I.
Oh wow.
We've been happily married for 40 years. God bless his soul. He is my inspiration behind anything I do.
Oh,
That is so beautiful.
And this is my house.
Mm-hmm.
It's a one-story level house, and it was perfect when we bought it, but now it's time to make some changes. And then this picture is my two pet birds. Their names are Kiki and Coco.
So cute. Oh my goodness.
And this is my favorite picture of Garfield and I. And this was actually when I was 39 or something.
Oh.
And 1 year before I was diagnosed with lupus.
Okay. Well, so now can you share with us some facts about lupus so that the audience can find out more about it?
Of course! That is why I'm here. And lupus is a chronic autoimmune disease. And it causes the body to attack. Why are you laughing, Garfield? You see something funny? You see something funny in the audience? Silly.
I'm just so excited to be here.
It basically attacks the body's own tissues. It's more common in women than men, and it's not transmitted through any type of contact. And there are various categories, but I have mild case of systematic lupus erythematosus, or otherwise known as SLE.
SLE, okay.
Mm-hmm.
Well, do you have any flare-ups?
Oh yes, Whitney, I do. And SLE, it leads to recurrent episodes or flare-ups in remission. Flare-ups lead to pain and inflammation of several tissues, affecting many organs, including the skin and the joints and kidneys and the blood vessels and nervous system.
Okay. So, because you're having all these flare-ups, what do you think in the areas of your life you're having the most trouble with?
Well, definitely toilet transfer, because Garfield would be sleeping in the middle of the night and I have to use the toilet.
She would wake me up.
Oh my. You okay with that?
God bless his soul for getting me up.
Okay, that's nice.
And I just wanted to be more independent in that area. And then I'm a paralegal, as you know. And at my work, after 1 hour at 9 a.m., I'd be getting all tired.
Oh my.
And I never got my work done. I'd just be sitting there. And I thought it was time to change something.
Mm-hmm. So that's why I remember I visited some of your places that you told me about.
Oh yeah.
So let's go ahead and show the clip of you in the paralegal office.
Okay.
So, tell me about your job and what you have to do.
Well, I have to do a lot of typing
Mm-hmm.
and answering the phones and a lot of filing and writing.
Okay, so how is lupus affecting your performance?
Well, I have a lot of joint pain in my wrists and my hands, and causes a lot of this to happen, which makes
Okay.
the typing difficult,
Right.
and
right.
I get so fatigued.
Yes.
It's like I work for an hour and I'm like,
So, oh wow, it must be exhausting.
it is.
How would you describe your pain on a scale from 1 to 10, if 10 is the worst?
Oh, right now it is probably at a 9, cutting it
wow.
close.
Okay, so we're going to try and reduce that to about maybe 2 or 3 eventually.
Oh, wow.
Yeah, so
Okay.
let me tell you a few things we can do to your office. So
Okay.
I see there's a little clutter around. You may want to maybe clean up a little bit first.
Yeah.
That will help. Now, okay, so for your phone, I have a great solution for that. It is
Really?
a Bluetooth.
Oh, blue what?
You don't know, have you ever
Do
heard
I
of
put it in my mouth, the tooth?
No, it does sound like that. But it actually
Oh.
fits on your ear like this.
Oh,
and then you
can I
just
try?
talk. Yes, you can.
And so I
Goes in
just
your
press
right
the button
ear.
to answer it?
Yes, you do, and you're free to do anything with your hands, wherever work
Okay.
you need to do.
Okay.
Yeah, so for typing, we are going to take out your keyboard, and we're going to give you these headphones with a microphone, so you can take that.
Okay, so I can just basically put this on at the same
yeah,
time.
with your
Oh, okay.
Bluetooth. And
Well, this
it-
works out perfectly.
It allows you to talk, and it's going to type what you say. So, yeah, that'll be helpful for you.
Okay, what else do you have?
What else? Well, let me think. That we did your
Why my
phone
mouse?
typing. Okay, so for your mouse, we're gonna give you an ergonomically designed mouse that will allow you to not have to move your mouse around a lot.
Whoa!
It has this rolling ball in the middle.
So I don't have to like just move the mouse around. I just move this rolling ball
Exactly,
around.
and then here you can scroll, and these you can click on the sides.
Oh,
and it
wow.
hooks up right to your computer,
Okay.
so that'll be good for you.
Okay.
And then, so I heard that it takes a long, you get very fatigued with going back and forth to your filing cabinets. So we're going to give you a portfolio so you can get the files you need before you start working. And then as you're working, alphabetize them, and then at the end of the day, you're going to put them back where they belong.
Oh, this will save me like 500 trips to the filing cabinet.
And you'll hopefully have less fatigue at the end of the day.
Yes.
So, a wonderful surprise we have for you. Let me bring in a complimentary office chair from the Whitney Santa Cruz show.
Oh, wow!
So this is going to provide you back support, and it's just going to be so much more comfortable than this chair you have
I'm gonna
here.
sit in this.
Yeah, so try it out.
Wow.
That was such a beautiful clip of your office. Are you enjoying the chair?
I love it. Whitney, bless your soul for giving me that. You didn't have to.
Anytime for you. So now I want to show the audience the bathroom clip that we did so that they know the different modifications that your occupational therapist did.
Uh-huh, let's look at that.
Okay.
Almost there.
Oh, Lordy!
You got it.
Oh, I don't think I'll be able to cleanse myself because of the edema.
Let me go get some toilet paper.
Okay.
I'll wipe you, dear.
Okay. As you saw in that clip, I was very dependent on Garfield. He'd be sleeping in the middle of the night, and I didn't want to disturb him, but now I'm independent because now he can snore away, and I don't even need him in the middle of the night. And my therapist has helped me so much. Thank you, Emmy.
Of course. So a couple of modifications that we've done since we started occupational therapy, we added the 3-in-1 commode because Miss Gertrude experiences pain and discomfort because of edema in her lower extremities. This has helped her. It has actually added a couple more inches than what it previously was. So instead of being 16, it's about 21 inches, which helps her. It decreases the angle in her hips and the effort that's required to get off or sit on her toilet seat. We also added the grab bars. This is good because it helps her with the muscle fatigue. Instead of having Mr. Garfield help her off like you guys had seen previously in the clip, this helps her to push off, so it gives her some stability as well. So if you want to show the audience how you're using this.
Here, my grab bars are helping me, and I'm sitting on the toilet.
Nose over toes, honey.
Nose over toes, okay. Got my nose and my toes, I'm getting up. And I don't feel that fatigue.
See, and she can do this independently without the help of her wonderful husband.
Wow, that was a very beautiful clip, Gertie. Well, I'm learning so much about lupus, but I want to know more about your own symptoms when you're having your flare-ups.
Okay, I have edema in my lower extremities, like, my knees and my ankles and my feet. And then during my flare-ups, I experience a severe amount of fatigue. Like, I feel like I'm feeling fatigued right now.
Oh, my.
And then I have arthritis in my wrists and my hands. And then, I have a common symptom that's associated with lupus. And during my flare-ups, I get butterfly rashes.
What does that look like?
It looks like a butterfly on my cheeks.
Oh, I remember you actually showed us a picture. Thank you for sharing that picture with us, Gertie. Well, now I have a question for Mr. Garfield. As a caretaker, how do you feel?
Well, prior to our wonderful occupational therapist, Abby, before she came to our house to fix our bathroom, my beautiful Gertrude relied on me a lot in the bathroom. And I started experiencing lots of lower back pain from having to get her on and off the toilet.
Okay.
So now with the changes in the bathroom, it's been much better. And
That's good.
I've learned how to cook and do laundry and all that stuff because on days that she's super fatigued, I had to do those
Step
things.
up on it.
Yeah, and I bought you an iPad.
Oh,
which
yes.
made our life so much easier.
Can you share this with me?
Sure,
Right here, honey.
sorry, baby.
Oh, it's on.
So what kind of schedule is this?
Okay, so the therapist, I just told her I wanted her to make me a schedule, but she said that it's focused on me and what I like to do.
Right.
So she put these Post-its, and the green Post-its are the ones that I have to do every day, like my ADLs or activities of daily living, like brush my teeth, showering,
Okay.
toileting. And then the blues Post-its are what I only do one activity, major activities every day of the week. So like here I have laundry on Monday, grocery shopping on Tuesday, and on days that I feel too fatigued that I can't even do 3 activities, my husband, oh my honey boo boo, steps in and cooks for me. What a delight.
All right, so now I think we're going to open it up to the audience and we're going to ask some questions about lupus.
I would like to know what is the aim of the medications prescribed for lupus?
Well, great question. And the medicine is supposed to better acute and chronic symptoms that cause pain and discomfort, including medicines like corticosteroids and immunosuppressive drugs.
And the only thing with the medicine is that immunosuppressive drugs lead to weak immune systems, which increase the risk of contracting a disease or infection triggered by bacteria, viruses, germs. And the medication can also lead to the predisposition of developing shingles and increased risk of developing lymphoma. Oh, honey.
Well, we learned so much today about life with lupus. Thank you so much for being my guest.
Oh, thank you for having me, Whitney.
Well, I actually have a surprise for you.
What?
I have your granddaughter, Nicki Minaj. and
Nikki?
Yes, she's
She
coming
came
here.
here on the show right now.
She's
She's
going to
here.
be singing her new hit single, Super Lupus.
Gertie, you got my lupus running away. Beating like a flare up is coming your way. Can't you hear that boom, da-dum, 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 da bass? You got that super lupus, boom, da-dum, 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 da bass. You got that super lupus. Garfield, I need you in my life for me to stay. No, 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 Garfield, don't go away. Garfield, you're the sweetest thing I have. Oh, Garfield, you got that lupus running away. Don't you see that flare up is coming your way? Oh, it'd be like boom, da 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 doom, da 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 lupus. Can't you hear that boom, da 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 doom, da 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 super lupus?